One package of Cheetah sensors contains all of the materials needed for a single application. The package contains 4 sensors, along with an instruction card showing how to properly apply the sensors and prep the skin. The sensors can be left on a patient for up to 48 hours. The instruction card within the sensor package shows the proper application of Cheetah sensors. Notice that you should place 2 sensors above the heart and 2 sensors below the heart. There are pictures on the sensors themselves directing you to apply to the upper and lower left and upper and lower right to better direct the sensor placement. Let's review the steps that are included with the instruction card for proper sensor application. 1. Shave or clip according to hospital policy body hair if needed. 2. Wipe the skin with sandpaper for optimal adhesion. 3. Peel the sensor. 4. Place the sensor on the 4 quadrants of the body. Apply connectors. 6. Secure the lead cables to the patient using supplied adhesive tape, Tegaderm, or other similar products which you have access to in your hospital. In reviewing optimal sensor placement, please keep the following tips in mind. Proper skin preparation is very important to obtain optimal signals. Cheetah NICOM sensors should be positioned around the heart. 2 sets of sensors positioned on the upper chest, trapezius, optimal position, or upper back. 2 sets of sensors positioned on lower ribs, flanks, or the lower back. In selecting the optimal location for the sensors, consider the following. 1. For optimal signal quality, lateral location is preferred for the lower pair, especially in obese individuals. 2. Find a spot that is outside direct contact with ECG stickers, venous lines, surgical drains, and the external pacemaker percutaneous lead. 3. It is not necessary to place sensors in a precise location or to maintain symmetry between them. 4. You can also use tape to secure the leads to the patient. When monitoring during anesthesia or for long-term periods, apply Tegaderm-type adhesive or other similar products to secure the lead in place. Also keep in mind the following when selecting optimal location for the sensors. 5. Place lower sensors on the lower rib cage at the level of the umbilicus. 6. Respiratory distress patients. Sensors may be placed on the back. Movement from abdominal breathing may cause issues during calibration. 7. Do not place sensors in a fold, which will shorten distance between paired sensors. As mentioned previously, there is a red indicator located on each sensor which directs one to the proper sensor location. Always ensure the sensor is in the upright position, with the small white tab pointing toward the patient's toes. Now, let's review the things to consider for application of the upper set of sensors. Pacemaker AICD present. Place the sensor at least 2.5 to 3 inches from the pacemaker AICD. Also, placement over the clavicle. Do not place sensor gel directly on clavicle. Place both above or below, or you can straddle the clavicle if needed. If you place the sensor below the clavicle, ensure that you place the sensor above the heart. The sensor needs to be above the aortic arch, since Cheetah NICOM measures flow in the aortic arch. There are also important tips regarding adequate sensor placement, replacement, and maintenance to keep in mind. Sensors need to be replaced every 48 hours. The sensors operate by gel, providing conduction between the skin and the sensor. Past 48 hours, the conduction in the gel starts to deteriorate, and there is a risk of having subpar readings on the NICOM. There is also a risk of skin breakdown if sensors are left on for greater than 48 hours. Also, be sure to document the date and time of changing of sensors to track when sensors need to be replaced.